Hey, Bawado.
No, this no. No, we will start here. Okay, we must turn the sideways. Má bú bá fàdọ̀ tí wá. Hot. And just to give her
Please, can I get gloves?
Remove the brake from the bed, please. Unbreak it. No, the bed.
It's there.
That's the suction machine. Where is the suction machine?
They have gone for 2.
NG2, please. Oh, I have it.
give me that part.
Ọlọ́run ẹ̀gbà wà lọ́wọ́ ọ̀rọ̀ mission house ìlú.
One of them are doing that one. It's meant to have seen her in antenatal.
Everybody, even her younger, there's a recorded conversation on their phone, the younger brother's phone, when they were talking to her on phone yesterday that she should please go to mother and child.
Recorded by who?
By the brother, younger brother.
They played it.
They played it for us. She said no.
Why would the guy record the? Does he do?
I don't know the.
He just said he has that feeling.
That they were telling everybody, telling her to go to mother and child. She went. He said she went to one madam, whether it's madam or papa, Ajawe Shola Haba Center. That's even worse than the TV.
This is probably how this is going. This is
Mother and child will take care of this person. You now take him to another private baby. Fake. What did I tell you, prophet? And now more jatiti, expecting was mother and child. Because of that, married Dr. Lunga, married Dr. Jai, and they will take care of this woman. So kí wọ́n máa gbókò ẹ̀ lọ sí gbogbo ní fẹ́ gbé sí ọkọ̀ ẹ̀dá wáyé. Gbogbo ilé aláwo gbogbo ẹ̀ kí ni díẹ̀. Kí mo sọ fún ẹ lánàá? Kò yẹ kó ṣe family wa bí lèyí o. Kò dáa kan tó ṣe fún family wa. It's not good. Ṣàmọ́ wa ní mother and child Ìdòwú Adéjù bẹ́ẹ̀. Àbúrò yìí ọmọ chief of staff kú sí mother and child báyìí o, but kì í ṣe mother and child náà ti pa o. Ẹ máa bọ̀, it's not. Ẹ máa bọ̀, kọ́ máa wá sọ pé wọ́n bà bí jẹ́, ẹ filẹ̀ lùjí sílẹ̀ ẹ máa bọ̀. Dáàdi ẹ máa bọ̀ ẹjọ́, mo bẹ̀ yí ẹjọ́. Yeah.
The 35-year-old Lollipara, 2 hours after delivery, that was when she presented to Rosie. At presentation, pulse was not palpable, blood pressure was not recordable. Immediately, we secured 2 lines in place, started rushing the fluid. We sent blood for grouping across machine to transfuse the woman. After 8 minutes, we got blood. We commenced transfusion. Then meanwhile, the patient had started gasping. We put up oxygen. We called the attention of anesthetists and the other doctors that were available. All of a sudden, we discovered she went into cardiac arrest. Then we started a cardiopulmonary resuscitation. That's what we call it. We tried to resuscitate, which lasted for about 40 minutes. While the blood was still on, we gave so many other things just to resuscitate the woman. But eventually, she couldn't come out of the arrest. After 50 minutes of resuscitation, we now certify the patient dead.
She delivered here. My junior sister, she put her. I told her yesterday she must not come here. She should go to Mother and Child. But she refused. She came here. They collect money, they pay money. This is the woman that she did. The chief woman. If you're talking about one way, you go and the brother come here. Mama, I was about time. If I can open your suit, I'm going to my lodger. Ẹgbẹ́ mọ́tò wọn tẹ̀lé wa, wọ́n wà ní mọ́tò gọ́ọ̀mẹ̀ntì, wọ́n ní sínú mọ́tò tẹ̀lé, wọ́n dẹ̀ ní sínú mọ́tò tẹ̀lé.
Ṣé bó wà ń bẹ̀? Ẹ sọ̀rọ̀.
Gbà tó fẹ́ bí ọmọ bó ṣe ṣẹlẹ̀ sọ fún mi.
Bó ṣe ṣẹlẹ̀ nígbà tán bí ọmọ tán ní kí n ra pólíbàgì wá wọ́n á lè kó olùbí ọmọ sí mo dẹ̀ rà. Wọ́n ṣàrí pé àwọn mọ̀mọ́ wá rí pé wọ́n ń bleed. Nígbà tí bleed ni ọ̀ṣà stop. Àyà mọ̀mọ́ dẹ̀ ti kó sókè. Wọ́n wá ní pé kí n jọ pé àwọn ò láyà tó yẹn pẹ́rù tí ń bá wọn pé kí n bá wọn wá taizin àǹtí mi ní pé àwọn máa wà òkè pé àwọn kan weak lásán ni. àǹtí mi ṣàfẹ́ lọ aṣáà gbé wọn sínú taizin aṣáà lọ sí hospital ó ṣáà attend sí sísítà mi so lọ́rọ̀ kan ó ṣàṣe ṣá sísítà mi ṣáà.
This slope will go 1 cm per hour, so 4 cm in 6 hours. She should be 10 cm, so plus 6, that's 1, 2, 3, 4, 5, 6. 6 cm.
I have learned a lot. I've seen a lot of things that I don't think I would have seen in the UK. A lot of very difficult cases, especially in pediatrics. A lot of mothers following different beliefs that to me are a bit exotic and a bit distant. I don't know, I would find it difficult to compare the situation in the UK and the situation here, specifically maybe just because of the different kind of cases that we see. Here they're very well equipped for things like malaria and a lot of tropical diseases, and in the ONG department they're always on hand, ready, waiting for a ruptured uterus, and I can't imagine the same kind of protocol happening in the UK. But in terms of things like resources, for example, I can see that they're always very cautious. Oh, there's no more gloves, or there's no more face masks, or where's the doctor? Those kind of things, which you might not see as much in the UK because we're so well stocked and we have as much as we need.
So put the baby down. Put baby down. Then up.
Put on the mother's chest. Mother's up.
Get your cord clamps.
Today I delivered a baby. That was amazing. I was scared, because I've not delivered a baby before, and with my limited clinical experience, I thought, I might do something wrong. But all of the nurses and I had Dr. Abiye, the consultant, there with me to support me, so it went well. The baby was healthy, the mum was fine, no complications, so I'm very grateful for that. Otherwise, it might have been a bit tragic. But no, my first experience delivering a baby was good. So.
Mama, ẹ wá wo òkú ẹ̀yìn kẹ́kàn wo kẹ́ máa lọ léyìn.
Ṣebí mo ti rí.
Níbo lẹ ti rí? Ẹ wọlé, ẹ gba bí kẹ́ wá wọlé màmá.
Ẹja lọ bẹ́ẹ̀, ẹja gbé.
Màmá ọmọ yín ni o, mo dẹ̀ fún ní ìjì.
Ṣọmọ yóò ṣá ìwọ rẹ.
Ẹ lè wojú yẹn lọ, please. I will tell the doctor now.
Àwọn mọ̀lẹ́bí ẹ̀fẹ́ jẹ́ kẹrí wọn, àwọn ló wà ní ẹ̀lẹ́ wọlé.
Wọ́n lè wojú yẹn lọ, lóye ni wọ́n lè wojú yẹn lọ, please.
It's okay. You just need a relative to follow her body to state hospital, to pathology. That's all we require of the family. It's quite saddening. She registered here also. And she was still over there. So it's so in such a situation, the best thing you can do for us, for her, for the populace, is for you to assist us.
Doctor to attend to that child.
They will attend to the child, Oga. How are you related to the baby?
It's my sister.
Okay. That means you will stay with us until we are through. If we require anything, we'll let you know. Case notes. Okay.
Mo ti bẹ̀rẹ̀ iṣẹ́ yìí ní 1958 last year ni mo ṣe bí tí mo commission rẹ̀ tí mo dẹ̀ sọ lórí rédíò tí mo sọ ní tẹlifíṣàn táwọn doctor sì dẹ̀ wá láti wá bá mi ṣe tó bá ní patient tí mo ní tó bá fẹ́ lágbára jù màá gbé lọ sí state tàbí kí n gbé lọ sí bí Òkúnrìn Ìbòyè ní Abiye olórí àwo ni bàbá mi iṣẹ́ ewé àtegbò ni ṣùgbọ́n nígbà tí mo ń ṣe tó wá jẹ́ ọ̀rọ̀ ọ̀làjú mo wá bẹ̀rẹ̀ sí í ṣe tírẹ́nì kiri àwọn tó bá ń ṣiṣẹ́ àtegbò ọ̀tọ̀ àwọn ọ̀gá àwọn tó bá wà ní láì ti dókítọ̀ àwọn gynecologist kìíní àwọn wọ̀nyẹn wọ́n mọ̀ nípa operation so tá a bá ṣiṣẹ́ kan tá a bá rí mọ̀ pé ó fẹ́ high ó lè jẹ́ pé operation làwọn máa ṣe màá gbé lọ sọ́dọ̀ wọn ìgbà tán bá débẹ̀ tán bá test ẹ̀ tán bá rí i pé kò lè bímọ yẹn fúnra ẹ̀ wọ́n á operate ẹ̀ á dẹ̀ wá òkè àtọmọ.
We knew that most of our women deliver outside hospitals. There was no doubt about that. And the reason they were doing that was because we healthcare professionals, the system created that vacuum. There was a disconnect between the patients, that is, the women and children in the communities, and the health facilities. So most women who go to hospitals are either those that are relatively well educated or those that have severe complications, that states of extremis.
Ṣé rí ẹlòmíì tí ò bá mọ iṣẹ́ yìí, tí ò kọ́, tí ò dẹ̀ mọ̀, tí ò mọ nǹkan tó lè fà á, ó lè wó mọ́ra torí owó tá gbà. Ṣùgbọ́n nǹkan tèmi ń ṣàkíyèsí jù ni pé tí BP èèyàn bá high, tí ìfúnpá rẹ̀ bá ń lọ òkè, tó bá wà lọ́dọ̀ mi, màá rí fáà rẹ̀ hospital. Mi ní take rárá. Kó tó bímọ, màá ti sọ fún pé kó máa lọ hospital kó lọ máa gba treatment. Ṣé mọ̀ pé nísìnyí ọ̀fẹ́ ni? So àwọn èèyàn ò fi bẹ́ẹ̀ wá sí ọ̀dọ̀ wa torí àwọn tó ti mọ̀ wá dáadáa tán mọṣẹ́ wa, àwọn lọ ń wá.
Okay, I've given 2 bags here, 1 girl and 1 boy. And okay, that's this day I asked my brother to bring his own wife here. Come on, please.
Tomorrow morning, I have a debrief with Dr. Oyene, the Chief Medical Director, just to go over what I've seen, just to give some feedback and how my experience has been. I'll say goodbye to all of the friends I've made and all the doctors and nurses that have taught me and supported me whilst I've been here. I'm definitely going to miss everyone. That's why I'm sure I'll be back.
What we need you to do for this baby is you'll be cleaning the cord every day. Then what's the baby feeding on? Yes. What's it eating? Okay, do you know how to prepare it? Yes. How? Okay. No, 20 and 10. 10. And 1 spoon, 1 level spoon, very good. So you mix it here. Yes. With which type of water? Hot water. Warm water. Okay. You understand? Okay, that's good. Okay, so who is going to be taking care of the baby after discharge? Who are you to the baby? Sister to me, we cannot say for now. So, but we'll give you as much time as you need to take care of the baby here before you make your decisions. You understand? Sorry.
Patient who died yesterday, registered in this hospital, attended about 3 antenatal clinic visits. And despite all the counseling, despite the health education that she had here, she still went to the mission home to deliver her baby. Unfortunately, she developed one of the commonest causes of maternal death, which is postpartum hemorrhage after the delivery. And again, when that happened, she was not brought here on time. It took them a long time to get her down here. By the time she came, it was too late. To the doctors and the nurses, it's always a sad event. It's always a terrible event for us, because when you put in your efforts in order to save a woman, eventually you lose the woman as a result of delay. And you see all the time, we always talk about this delay, and that is one reason why a lot of women die. And so to the nurses and doctors, a very sad event, pathetic, you know, and something that is emotionally disturbing to them, because they put in so much effort, yet they couldn't save the situation.
I'm happy because my sister told me it's okay now. So far, she's the one that wants to take care of the baby. Because I don't release the baby for his father. I have my own reasons. The man has a wife. And I don't know the condition of the house. So that this baby, there is no mother. So it's going to be a big problem. Even I've talked to him. That the baby is going to be in care of my own family.
What we can do as healthcare practitioners, as government, is to keep on with the campaign. You need to let people know that look, you need to deliver in a facility manned by skilled birth attendants. Those are people who have been trained to proficiency in the art of conducting normal delivery and who know what to do when there's complication, either to attend to the complication there or to refer if they don't have the facilities to attend to some complication.
We have to find a way of breaking that cycle of a woman thinking that it's better to deliver in a church than a hospital. And to me, it was quite personal many times, because some women actually want to come to hospitals, but because of the mother-in-law, the husband, they are forced to remain in labor for days on end until they become complicated. And it's really quite painful to me to watch a woman just take her last breath and she's looking at you and saying, oh, if only she had known, if only she had known, and she goes. And you know, you can't leave that image, can't leave your mind for a long time.